Good afternoon, everyone. Thank you for joining us today for the BEADS Provider and Case Manager webinar. I'm Holly Wimsatt. I have the privilege of being the Director of the Bureau of Disability Services, and I'm really glad to be able to spend some time with you this afternoon. I hope everyone has had a nice holiday thus far and is ready for 2026 because it is almost here. So next slide, please, Richard. Before we get started, I do want to talk about how to use live captions. If we can go to the next slide, please. Thank you. To turn on live captions and subtitles, simply select Caption Subtitles On in your video controls. To change the caption language, select Settings, and then Captions/Subtitles, and choose the language you want. Today, we're going to do updates for all providers, then some updates for health and wellness and traumatic brain injury waiver providers. Case managers are included when we talk about providers. Updates for the community integration, habilitation, and family supports waiver providers, and then our typical call for future webinar topics. All right. We'll get started. We have a lot to cover, so I'm probably going to talk way too fast, but we will, of course, post the recording. So as I hope you have seen in our announcement, CMS has approved the waiver amendments that we submitted over 3 months ago that are effective tomorrow, December 31st. Those amendments include amendments for the health and wellness waiver, the traumatic brain injury waiver, the Indiana Pathways for Aging waivers, the community integration habilitation waiver, and the family supports waiver. So we are excited to implement these changes, and we're going to walk through just a few of those. We have talked about these changes before, but certainly want to walk through them again, some of the more impactful ones. So the approved waiver amendments, as I noted, have an effective date of December 31st or tomorrow. We had some service definition alignment across all 4 of our waivers, so please be sure to review the waiver documents. Again, in the waiver documents, there is a section in the beginning that talks about purpose of the amendment, and that outlines all the things that have been modified in some way. And then you can just go to that particular section on waiver service definitions and find what you need. But they can be found at the 4 waivers that BEADS administers can be found on the BEADS webpage. And again, these changes are effective tomorrow. Some of the services that have been modified or added in some way are behavior support services on the FS and CIH waivers. Self-directed services have been added across all 4 of the BEADS waivers. And today I'm going to stick primarily to the 4 waivers that BEADS administers, though I should note that some of these waivers also, some of these changes also impact the Pathways for Aging waiver, such as the self-directed services. And then benefits counseling is a new service that we are adding. And again, we've talked about that before. For additional information, including procedure codes, modifiers, rates, and any kind of service limits, we are encouraging you to look at the IHCP bulletin BT 2025169. Next slide. So with the behavior support services, currently, today, we have behavior management basic, and then behavior management with the clinical supervision. as of tomorrow, and beginning January 1st, the behavior support services, the behavior management basic, is ending and is replaced with a new model. What that new model is consultation, comprehensive, and then the functional behavioral assessment. The consultation is an option for individuals on the FS and CIH waiver beginning January. It is just what it sounds like, a consultation. It's limited to 3 hours monthly. That will be authorized. All of the behavior support services will be authorized quarterly instead of annually. So the prior authorizations that generate from the notice of action service authorization will be 3-month prior authorizations. So the consultation is an option for individuals. Then there is the comprehensive, which is limited to 12 hours a month or 144 hours a year. That particular component, if you will, direct component under behavior support services is the most like what we have today, and that is an ongoing service. And then the other direct component is the functional behavioral assessment, which is a 20-hour total within 60 days, and that is just that functional behavioral assessment. Within the new service definition documentation requirements, providers will be required to use state provision templates for all behavior support plans, functional behavioral assessments, and quarterly reports. These new templates must be used beginning December 31st, and all current behavior support plans, functional behavioral assessments, and quarterly reports should use the new template upon the next iteration or update of the plan, assessment, or quarterly report. So I want to clarify that a little bit because we have gotten a lot of questions around that. We do not expect, if a person has a behavior support plan today and they are continuing with the comprehensive direct component of behavior support services, we do not expect, nor do we want, behavior support providers to simply transfer that onto the new template because we have a new template. The next time that behavior support plan is updated or renewed, for lack of a better term, then that template would be used. The templates can be found under the resources tab in the BEADS portal. The other thing that I would mention is these are the direct components of behavior support services. There continues to be the indirect component of behavior support services, which is the clinical supervision. Again, we have covered this in previous presentations and in IHCP bulletins, but the clinical supervision remains an indirect component of our behavior support services array effective tomorrow. Next slide. Then we have our self-directed service options. We are so very excited about this. Beginning January 1st, self-directed service options will be available on the CIH, FS, Health and Wellness, TBI, and the Pathways for Aging waivers. These services will be authorized annually to allow for life of plan and will be authorized based on a self-directed budget calculation that includes the member's assessed needs and limitations within the services and waiver they are utilizing. So members will now have the ability to self-direct the following services. On the CIH, it would be the residential HAB support, the hourly residential HAB support, respite and workplace assistance. On the family support waiver, it's participant assistance and care, or PAC, respite and workplace assistance. And on the health and wellness, traumatic brain injury waiver, and the Pathways for Aging waiver, those services that can be self-directed are attendant care, respite care services, and home and community assistance. So we have some information and resources in the BEADS portal resource page. under HCBS Self-Direction if you want more information on that. But we are very excited to be able to offer self-directed services to individuals across all 4 of our waivers and, of course, the Pathways waiver. All right, we have added a new service of benefits counseling on the CIH, FS, Health and Wellness, and TBI waivers effective tomorrow. Benefits counseling services assist an individual in understanding the potential impact of employment on the person's benefits, such as SSI, SSDI, Medicaid, Medicare, nutrition programs, housing assistance, ABLE accounts, and other federal, state, and local benefits. Benefits counseling is intended to address concerns about work-related income compromising benefits by providing the individual and potentially their family with the information they need to make an informed choice regarding pursuing employment or career advancement. We, as a bureau and as a division, are committed to ensuring that individuals, all individuals, have an opportunity to pursue competitive integrated employment. We understand there are lots of questions and even some concerns around how competitive integrated employment may impact benefits. And this is one way we believe we can support individuals in making informed choice about competitive integrated employment. Who can utilize benefits counseling? It can be provided to individuals considering or seeking competitive integrated employment or self-employment, career advancement, or to individuals who need financial problem-solving assistance to maintain their competitive integrated employment or self-employment. Reimbursable activities include individualized benefits analysis and counseling, development of a work incentive plan, education regarding income reporting requirements, and technical assistance to complete and submit the appropriate forms and supporting documentation required for work incentive programs. Another piece of the 2025 waiver amendments is around the extraordinary care allowance. So I believe you will recall a legally responsible individual, or LRI, is any person who has a duty under state law or regulations to care for another person. This would mean the parent, biological or adoptive, of a minor child, or the guardian of a minor child who must provide care to the child. LRI also includes spouse as well. So legally responsible individuals, parent of a minor child, or spouse. At the option of the state and under extraordinary circumstances specified by the state, payment may be made to a legally responsible individual for the provision of personal care or similar services. And that's CMS allows that. The state allows payment to be made to LRIs for the provision of only participant assistance and care, or PAC, on the family support waiver, attendant care on the health and wellness waiver when the conditions specified by BEADS are met. So we're going to talk again about the required conditions for the extraordinary care allowance for the provision of attendant care and PAC. PAC and attendant care are not participant directed. The PAC and attendant care services are provided as extraordinary care. Extraordinary care in the provision of services means care that the individual is unable to perform independently to meet his or her intensive nursing care needs under the supervision of an interdisciplinary team. Intensive nursing care needs include continuous ventilator care, tracheostomy care, TPN, or other comparable nursing services approved by FSSA. It's important to note that the care must exceed the range of activities that an LRI, parent or spouse, parent of a minor or spouse, would ordinarily perform in the household on behalf of a person of the same age without a disability or chronic illness. So that is the definition of extraordinary care that must be met. Again, the extraordinary care is a characteristic of the needs of the individual in order for an LRI to provide PAC or attendant care. These are provided in alignment with the waiver service definition and limitations found in the waiver document. So PAC and attendant care, when provided by an LRI, when this extraordinary care definition is met, must still be provided in alignment with the service definition. The LRI is qualified to provide PAC and attendant care services in alignment with the qualifications found in Appendix C of the waiver document. The LRI is employed by or contracts with an FSSA-approved agency, and payment for the PAC or attendant care services provided by an LRI is only made to an FSSA-approved provider agency and is never made directly to the LRI. There are some limitations, and that includes that the maximum number of hours of PAC or attendant care services that may be reimbursed when provided by an LRI must not exceed an aggregate of 40 hours per week. So what that means is an individual who is a waiver participant and whose needs meet the extraordinary care definition, an LRI or LRIs can provide up to 40 hours per week for that individual, not per LRI, but per that individual waiver participant. PAC and attendant care services will not be reimbursed when provided by an LRI if the participant is self-directing this service. So again, CMS, our federal partners, allow states to make allowances for LRIs to provide some services, but there are lots of rules around that and lots of requirements of the state. So we must track service plans that include the provision of PAC, attendant care, or structured family care by an LRI for monitoring purposes. And that is a federal requirement. Additionally, provider agencies and their employed or contracted LRIs who receive payment for the provision of PAC, attendant care, or structured family care will be subject to service plan monitoring by the case manager. These practices ensure that selection of service providers during the planning meeting is based on an understanding of what the individual wants or needs, and that services delivered will continue to meet the needs and goals as well as the best interest of the individual. We recommend all providers and case managers review the waiver document in its entirety to ensure compliance with all extraordinary care allowance requirements. Some additional changes that are in the 2025 waiver amendment. The home health aid or home health agency license requirement has been removed from attendant care, home and community assistance, integrated healthcare coordination, specialized medical equipment and supplies, and transportation effective tomorrow. Personal service agency licensure is still required for attendant care and home and community assistance unless the person is self-directing those services. The supported employment services definition for the traumatic brain injury waiver has been revised to align with the extended services definition on other waivers. That just impacts the TBI waiver. Documentation requirements for attendant care have been updated to hourly instead of once daily. This impacts the health and wellness waiver. The residential-based habilitation definition for the TBI waiver has been revised to allow individuals living with housemates to use a shared staffing model for that is just the TBI waiver that already exists on the CIH waiver, which is the other waiver with residential housing support service. And then home modification and home modification assessment have been combined into one service per CMS's request. Both functions still exist. There is still an assessment, there is still a modification, but they exist under a single service. And this impacts the CIH and the family support waiver. Additional changes: rec therapy and music therapy have a maximum of 6 hours monthly. Again, impacts CIH and FS. New enrollment in facility-based pre-vocational services is discontinued in preparation for the coming end of facility-based pre-vocational services. Again, impacts the CIH and family support waivers. The level of care screening instrument has been replaced with age-appropriate tools from the Inter-Eye suite of instruments to determine if a person has the functional support needs to qualify for BEAD services related to their intellectual or developmental disability. Adults will be assessed using the Inter-Eye ID intellectual disabilities tool. Children ages 4 through 17 will be assessed using what's called the CHIME DD tool, which is the Child and Youth Mental Health Developmental Disability tool. And children 0 to 3 will be assessed using the Early Years tool. Annual assessments will still be completed by a person's case manager, and initial assessments will still be completed by a BEAD service coordinator. This applies to the CIH and the family support waiver only. Now, as a reminder, if you are a provider or case manager for the health and wellness, traumatic brain injury or traumatic brain injury waivers, that Inter-Eye suite of instruments is familiar to you, and that's because we use some instruments from that set or suite of Inter-Eye tools to assess nursing facility level of care as well. The nursing facility level of care are completed by a vendor, a statewide vendor, Maximus, with the ICFID level of care. That will continue again to be, those initials will be done by the Bureau of Disability Services state staff and annually by case managers on the CIH and family support waiver. All case manager responsibilities have been moved to the case manager service definition instead of adding them to each individual service. Additionally, the term care manager has been changed to case managers to promote clarity across all 4 waivers. Additional changes include some updated information about short-term and long-term budget requests, or STBRs and LTBRs, to reflect current practice. This is the CIH only. There's a typo there. There are no STBRs and LTBRs on the family support waiver, so we will correct that. Each allowable family member who is a paid caregiver of attendant care to their loved one may not exceed a total of 40 hours per week. This is a family member, not an LRI. The total number of hours of attendant care a person is authorized to receive is determined by the individual's assessed need. That is what determines. So when we say a family member, non-LRI, who is a paid caregiver of attendant care, may not exceed up to 40 hours a week. If the person only needs 20 a week, then that's what would be authorized, regardless of who is providing that service. Interruptions and extensions. Accurate utilization of the interrupt, extended interrupt, and waiver term functions in the portal is essential to maintaining the integrity of waiver management processes. These actions must be entered promptly and correctly to ensure that individuals receive continuous and appropriate support as they transition through various life circumstances. The portal provides case managers with dedicated grids that display waiver status during periods of interruption or termination. These resources are located under the Waiver Management tab and offer case managers clear visibility and oversight, enabling effective monitoring and timely action. So we have a bit of a screenshot here. Really cannot stress too much how important it is for case managers to stay on top of interruptions. That is very impactful as we continue to track waiver capacity. So please, case managers, make sure you're checking those grids and make sure that you're entering those interruptions as needed. Next slide. Case managers are responsible for entering case notes that include the reason for the interrupt or termination, and case managers are responsible for ensuring the individual has an understanding of the action being taken and what they need to do if applicable. If the interrupt termination does not have a case note, BEADS cannot approve it. If you don't document it, it didn't happen, and we don't have visibility into it. So we really need case managers to document. Case managers should do their best to avoid auto terminations, rather extending the interrupt when appropriate, or, if appropriate, terminating the waiver. We have a complaint policy update. So the Bureau of Disability Services, or BEADS, has updated its complaint investigation policy to strengthen transparency, ensure consistency, and reinforce protections for individuals receiving BEADS services. Some of the key updates include an updated name change to reflect BQIS being integrated under BEADS. That happened some time ago, but we're just getting to updating that. Clarifications on procedures such as triaging, classifying, investigation protocols, personal health information and confidentiality standards, interview processes and documentation review, investigative summaries, and corrective plan procedures. This policy will be published at the current BEADS policies on January 16th. So be on the lookout for that updated policy. All right. So the Indiana Health Coverage Programs, or IHCP, announced in a bulletin, specifically Bulletin 2025150, that a $5 paper claim processing fee was being implemented. This IHCP will implement the paper claim fee with claim submissions beginning January 29th of 2026, so about a month from now. The $5 fee will be applied to each initial fee-for-service paper claim submitted for processing through Gainwell Technologies. Fee collection will be applied through an accounts receivable procedure where the per claim fees owed will be calculated and deducted from providers' future IHCP claim payments. An explanation of benefits and description supplied on the remittance advice will be published at a later date. It's important to note the $5 paper claim processing fee is applied to each initial submission of the claim. It will not be applied for corrected or adjusted claim submissions. And exceptions to the paper claim fee implementation are as follows. Claims that are classified return to provider, or RTP, for incorrect submission, and then claims that are required to be submitted for special batch processing. So those are the exceptions. Additionally, CMS announces new provider enrollment application fee for 2026. So on December 3rd, just a few short weeks ago, the Centers for Medicare and Medicaid Services, or CMS, announced that the provider enrollment application fee will change for 2026. Effective January 1st, day after tomorrow, IHCP providers subject to the application fee will be required to pay an enrollment application fee of $750 with initial enrollments, changes of ownership, and enrollment revalidations. Applications submitted online or postmarked before January 1st of 2026 will be accepted with a fee payment of $730. Applications submitted online or with a postmark of January 1st, 2026 or later must pay the $750. All right. We are now going to go through some updates for the health and wellness and traumatic brain injury waiver providers and case managers. All right, calendar year 2026 allowable room and board rates. So a memorandum was issued to update the allowable room and board rates for calendar year 2026 that an assisted living facility may charge individuals who participate in Indiana's health and wellness, traumatic brain injury, or pathways waivers, or in the state's Money Follows the Person demonstration program. This memorandum that was issued supersedes all previous communication regarding allowable room and board rates. So under 455 IAC 3-1-12, participants living in assisted living facilities are entitled to retain at least their personal needs allowance as established by the state of Indiana, a provider, after assuring that the participants retain their P&A, may bill participants up to the current maximum federal Social Security supplemental security income. So the monthly maximum federal SSI amount for 2026 is $994 per month for an eligible individual based on a 2.8% cost of living increase. Next slide. Providers may not charge Medicaid eligible individuals a room and board rate for a studio apartment that exceeds the maximum SSI amount for 2026. A participant who wishes to select a larger room may pay extra for any unit exceeding the size of a studio based on the monthly amount determined by the facility. All right, nursing facility level of care assessments. So Maximus, our statewide vendor that completes nursing facility level of care determinations or issues determinations, has had some trouble reaching individuals and families. This is still a relatively new process for individuals and families. The vendor Maximus has been on board with doing nursing facility level of care assessments for the purposes of home and community-based services Medicaid waivers since July 1st. So about 6 months. Ooh, yeah, about 6 months. They have had trouble reaching some individuals and their families or representatives regarding their assessments. The established process is to attempt contact at least 3 times, followed by a letter. And those are like 3 phone calls at different times of day, different days of the week, followed by a letter. If there's no response, the nursing facility level of care assessment is canceled. In other words, Maximus can't assess someone if they can't get a response from them to get it scheduled. To support successful completion of these nursing facility level of care assessments, we are asking that if you are working with an individual on the health and wellness or TBI waiver, particularly if you're a case manager, that you notify the individuals and their representatives or families when their annual level of care is coming due, and that they should expect a call from Maximus. verify their contact information as a case manager, ensure that the phone number and mailing address listed in the BEADS portal are accurate and up to date. That's the information that Maximus has in order to contact individuals. These steps, we hope, will help reduce canceled nursing facility level of care assessments, improve communication with families, and ensure timely completion of annual levels of care. We want to ensure people are assessed in a timely manner. So we are asking case managers to help us talk to individuals and families about responding to Maximus when they are contacted. It is a waiver requirement that those eligibility assessments or level of care assessments, whether we're talking about nursing facility level of care or ICFID level of care, that those are done annually. So it's very important to the individual for continuity of services to ensure that their assessment is completed timely. Next slide. All assessments for individuals aged 17 and under are completed face-to-face. All denials or potential nursing facility level of care denials are reviewed both by Maximus and by the Bureau of Disability Services. And the Bureau of Disability Services is the only entity that can determine denials for level of care. Individuals do receive a copy of their appeal rights when they receive the level of care outcome letter. Right, PCISPs, action required, so person-centered individualized support plans. Unlike CAMS, the portal does not automatically deny or cancel PCISPs that have an outstanding RFI or request for information with the case manager. So CAMS would automatically deny a service plan if a request for information was sent to a case manager and there was no response. It would eventually just automatically deny or cancel that service plan. The portal does not do that. It requires the case manager to respond to that RFI. So as a result, the PCISP pending authorization grid in the portal contains a large volume of PCISPs. Case managers, we are asking you to review the pending authorization grid and identify the PCISPs with outstanding RFIs or requests for information. For each outstanding PCISP, either provide the necessary response to the RFI or cancel if it is no longer valid. This is part of just maintaining the information in the portal and keeping it accurate. So case managers, case management organizations, case management entities, we need you to look at that PCISP pending authorization grid and work through those on your caseload. All right, we are now at the provider and case manager updates for the CIH and family support waivers. Well, this is exciting. As you all know, FSSA launched a statewide training curriculum platform and direct support professional registry that went live on July 1st of this year, so just 6 months ago. Many providers and home and community support professionals, or HCSPs, formerly known as DSPs, direct support professionals, have completed the training and registered. If you have done that, thank you. We are thrilled to see that training being utilized. As a reminder, all HCSPs must be trained through this required platform by January 1st, so day after tomorrow. That's going to be here very, very soon. If you are an organization who employs HCSPs providing applicable services and have not registered, we need you to fill out the administrator survey immediately and then email it to hcsptraining@sierrahealth.com. and to beads.help@fssa.in.gov, stating that you have completed the survey. This will then allow our support team to set up your group with the appropriate admin access and share instructions for getting your learners started with the training program. Again, we are at December 30th, and HCSPs must be trained through this platform by January 1st. Some additional HCSP reminders. If the HCSPs are trained on a provider's current training platform, they will need to be retrained using the HCSP platform before January 1st, day after tomorrow. This could mean that applicable HCSP staff are taking 2 trainings prior to January 1st. Their employer's required training and this required HCSP training. It's important to remember that an HCSP cannot provide the applicable CIH and FS services after January 1st of 26 without successfully completing the training, receiving their certification, and appearing on the registry. More information will be forthcoming about the medication administration curriculum training. For now, providers should continue using their existing medication administration training process as required by current regulations. We are also excited to let you know that the HCSP training program is now available in Spanish, so learners can have both the English and Spanish learning paths active simultaneously. Once the Spanish learning path is activated, learners will be able to access the Spanish content and earn their certification through the Spanish learning path. We have here some statistics on the HCSP training. The total number of learning path certificates granted since July 1st, as of December 19th, was over 38,000, almost 38,100. So really great numbers. Total time spent learning from July 1st to the end of November was 138,559 hours. The most active day of the week as of the end of November for this active learning is Wednesday. And then the user device distribution as of the end of November, 52% used a desktop, about 46% used the mobile and then device, and then about less than 3% used a tablet for the learning. So if we look at a reporting period from November 1st to November 30th, this is the certification learning path. The dark blue is not started. The light blue is in progress, and the greenish yellow is certified. So you can see we've got 26% have not started as of the end of November. 14% were in progress, and 60% were certified. So again, very good numbers. I will not read these numbers to you, but for reporting from the month of November, you can see the different foundational modules, and then the fundamental modules, and then the learner information survey, the midpoint learner experience survey, and the post-training learner experience survey. So if you look to the far right, the completed numbers look really good, you know, for the different modules and all. But we just wanted to provide some data to you so that you could see the progress that's being made. So again, a big thank you to our providers and our HCSPs for engaging with this training platform. Next slide. So we have also, FSSA has updated its waiver invitation process to improve access to and use of services by implementing a deadline for individuals to complete steps to access the family supports and the community integration and habilitation waivers. The following procedure brings these waivers into alignment with how FSSA processes invitations for other waivers such as the health and wellness and the Pathways for Aging waiver. So individuals have received notice from BEADS of the following. So individuals who were invited or approved for the family support or CIH waivers from January 15th through July 15th will have 60 days from the date of the notice to complete the required steps to become active on the waiver. Next slide. Individuals invited or approved July 16th through November 25th of 2025 will have 180 days from the date of the notice to complete the required steps to become active on the waiver. The required steps are as follows: complete and obtain Medicaid financial eligibility, schedule, complete, and meet functional eligibility through a level of care assessment, and then work with the assigned case manager to complete the service plan. A person must be active on the waiver to move forward, and that must happen within 180 days for those invited from July 16th through November. Individuals invited or approved on or after November 26th of 2025 must complete the following steps. You must notify, or the individuals must notify BEADS of their decision to accept the waiver within 30 days from the date of the invitation or approval letter. When accepted, the individual must complete the following required steps within 180 days from the date of the invite or approval. Complete and obtain Medicaid financial eligibility, schedule, complete, and meet functional eligibility through a level of care assessment, and work with their assigned case manager to complete the service plan. In instances where the process has not been completed within 180 days, the invitation will be rescinded. The individual will not be placed back on the waiting list. They may reapply for waiver services at any time by contacting their local BEADS office. There is an IHCP bulletin on this. It's BT 2025170. If you want to take a look at that, you may send questions to beads.help as well. Again, we are aligning this process with the process that already exists on the health and wellness and the Pathways for Aging waivers. I do want to note this is about inviting from the wait list and inviting to the CIH waiver. This does not, individuals may still apply for BEAD services. They may apply and if eligible will be put on the wait list. This particular process is about those who have been invited off the wait list or invited due to a reserve capacity on the FS or CIH. Next slide. I want to talk a little bit about management of individuals' finances. So the provider identified in an individual's person-centered individualized support plan as being responsible for the individual's finances, which is typically the residential provider or rep payee. If a provider is that, must assist an individual to obtain, possess, and maintain financial assets, property, and economic resources, maintain separate accounts for each individual, provide monthly account balances and records of transactions to the individual and their legal guardian. Those records must also be provided to a case manager. It is imperative that the provider comply with these requirements as outlined in 460, and that's 460 IEC 6-24-3. So if an individual should be provided monthly account balances and records of transactions, as should their legal guardian. And that is without them requesting it. It should be a matter of routine. Additionally, guidance for case managers on their responsibilities on financial management are outlined on page 56 of the Quality Guide for Case Managers located in the resource section of the portal. going to talk a little bit about incident reporting and unapproved residential transitions. It's important to note that BEADS is the designated placement authority for individuals receiving services and supports from or through the CIH and family support waivers. No transition should occur without prior approval from BEADS. If a transition takes place without BEADS approval, an instant report must be filed, and the instant report will remain open and active until all required documentation has been submitted to BEADS and BEADS has formally approved the transition. Providers must respond to every follow-up request from BEADS. Each response must be documented within the incident report until the transition is approved and closure is authorized. Next slide. All right, we are at future webinar topics or topic ideas. Again, we want to make sure that this time that we have with you, that you are willing to share with us, is useful and valuable to you. If you have ideas about future topics, if you have questions from today, please email the BEADS Provider Services at fssa.in.gov. Share with us what you'd like to hear more about and any questions you might have, and we're happy to get back with you. Our next provider and case manager webinar is scheduled for January 27th at 3 o'clock Eastern Time. We will be covering a variety of topics then as well. But again, if there's something you want some information about, shoot us an email, let us know, and we're happy to work to accommodate your requests. Again, I want to, on behalf of BEADS and the BEADS team, I want to thank you for joining us today. We want to wish you a very happy new year in 2026. And we look forward to continuing to partner with you and collaborate with you to support individuals and families in Indiana. So thank you for what you've done in 2025, and we look forward to what we will all accomplish in terms of supporting others in 2026. Have a great rest of your day.